Nose bleeding. This is one of the common issues that people normally face. But I want to tell you that if you are that type that you always have nose bleeding today, stay tuned and let's talk about nose bleeding. There are two types of nose bleeding. We have two types of nose bleeding: the anterior nosebleed and the posterior nosebleed. When we talk about anterior nosebleed, it occurs when the blood vessels in the front part of the nose breaks and bleed. And the posterior, it happens when the deepest part of the nose break and bleed, flowing down the throat with blood. So posterior nosebleeds are very serious and severe and cause for alarm. So we have two types. The part that happens at the frontal part of your nose when the blood vessels in your nose breaks and bleed. And the posterior is the one which happens at the back, the deepest part of the nose, with blood flowing down the throat. And this is very serious and it's cause for alarm. So what are the common causes of nose bleeding? What actually causes our nose to bleed? Number one, dry air. When you are living in a very dry climate or a heating area, your membranes or the membranes in your nose get dried up and crack, and this can lead to nose bleeding. When the temperature is very warm, that's why in Harmattan or when the weather is very dry, the membranes, the lining in our nose gets dried up and they start to crack, and this can cause the blood vessels in our nose to also bleed. Number two, when you are that type, you are picking and scratching your nose. So picking or scratching your nose. If you scratch or pick your nose, it can also bleed. You see some people, they always pick their nose and will be scratching their nose. It can also lead to nose bleeding. Number three, medications. There are some medications like antihistamines and decongestants, which can also cause our mucosal lining, the nasal linings, to also crack and bleed. So sometimes we try to, when we get wet nose or runny nose, we try to use, we call them decongestants, drugs that will decongest our nose, right? And it dries the membranes. When these drugs are used, they end up drying up your nose and they can also cause severe hardening of the membranes, thereby cracking and leading to nosebleed. When there's foreign objects, when foreign object falls, any object falls very hard on your nose, it can trigger bleeding. We call something chemical irritants. When we're exposed to certain chemicals, you see that sometimes you enter a chemical room or a very high chemical, when you inhale them, it causes your nose to also bleed. Allergic reactions. Allergies may contribute to nosebleeds. You see, sometimes you are allergic to something, and the moment you get closer to that particular thing, you tend to react. We call it allergic reactions. So anything that you are allergic to can also cause you to bleed in your nose. Another point that can cause our nose to bleed: repeated sneezing. When we have repeated, frequent sneezing can irritate the blood vessels. So it's like you sneeze frequently and repeatedly. It can cause the brain, due to the severity, how severe and how the intensity of the sneezing, it can cause the membranes of the nose to also crack and bleed. Also, cold air. As the dry air can do that, the cold air too can also lead us or cause us to bleed in our nose. In our upper respiratory system, we can have upper respiratory infection. And lastly, when there's large dose of aspirin, high dose of aspirin may increase the risk of your high blood pressure, bleeding disorders, blood clotting disorders. So aspirin tends to increase our bleeding factors, and it affects our clotting factors too. So when there is high dose of aspirin, taking more aspirin, you may end up having nose bleeding. A little trigger can cause your nose to bleed. So when do we seek medical attention when you have nosebleed? When do we seek medical attention when we are bleeding from our nose? Basically, most nosebleeds don't need medical attention. But you have to seek help when your nose bleeds longer than 20 minutes, or when it occurs as a result of an injury. Sometimes something fell on it, or you had an accident, you had a punch, and you are bleeding severely. That one you have to seek medical attention. If not, normal nosebleeds does not need medical attention. And nosebleeds usually is not a sign of a serious medical problem. If you have concerns, consult a healthcare professional. So you having a nosebleed doesn't necessarily have to seek a medical attention or it's a cause for alarm. But if the case intends to be severe, don't hesitate to seek medical attention. This is Health Matters with me, Village Doctor. Please, if you like this video very useful, subscribe. Click on the plus button to subscribe, like, and comment. Your questions and answers are welcomed.